Hello, my name's Dearden-Phillips. I'm from Stepping Out, and the film today is for people who are working in councils or the health service who are wanting to spin out and create a new organisation, specifically providing integrated health and social care around the individual. I want to talk about three things on this film. I think the first is to talk about some examples of organisations that are already doing this at this time. You may or may not have heard of an organisation called Sequel. Sequel's based in Swindon, and they used to be part of the PCT, or what's known as CCG, and they spun out from that organisation in 2011. That was about several hundred staff and £30 million worth of services. And the mission they spun out with was to create a new type of service which was basically not health, not social care, but all about that person. So if you go to Sequel's website, which is sequol.org, you will read all about Sequel. And when you talk to Sequel, as we have, what you will find that they're saying is that the freedom that they've got through not being part of the NHS and not being part of the council is what's giving them the opportunity to create and innovate that new kind of service. So there are plenty of really inspiring examples of mutuals that are providing integrated services around the country. So I'll give you a list of a few if you want to go and investigate. You can look at Navigo, which is up in North East Links, which is an integrated mental health provider. You can look at Care Plus, also in North East Links, which is an integrated health and social care organisation. You can finally also look at Spectrum in Wakefield in Yorkshire, which provides an integrated service around extremely vulnerable people in that particular community. So there are lots and lots of examples of where mutuals are pushing this forward and using the freedom that that type of organisation or form gives them to do that. So those are some examples. Why do you think, I want to talk a little bit now about why this might be better for you than what you're doing now. You know, you're either working for an organisation in the public sector, or you're in an organisation that's about to spin out. If you talk to people that have done this and have made it happen, what you'll hear are three things. The first thing you hear is all about the energy that's created in a new organisation. They'll talk about the opportunities that that having more power at the front line gives to the people who are at the front line to make the service work differently. There is less bureaucracy, there is less there is less paperwork, there is less obstruction to getting the service right. And thirdly, people will talk endlessly probably about the type of culture that a new organisation, a new spin-out create. Because in these organisations, the people who are running the organisations are often people who run the services themselves. And that makes a real difference to the way the services look and feel. In terms of integration, it's a bit of a buzzword, and it's something which is happening very quickly in many parts of the country, but not as quickly in others. When we talk about integration, we're simply normally talking about the bringing together of services around the individual. Now, historically, the problem that people have had, you know, that if you're a 91-year-old with frail and elderly with dementia, is that you're getting an input from the council, you're getting a carer, you're getting someone from the community health service, you've got the hospital that's dealing with you, you've got your GP. And the trouble is, for that 91-year-old lady, is that it's not coming together it's not being held together very well. So you don't really, nobody's actually got a hold of your situation. Nobody's helping overall things to come together in a coherent way around you. When we talk about integrated care and support, that's what we're talking about. We're talking about bringing together this support in a more intelligible way for the person involved, so that that lady knows better what's going on, and that her life and her condition is being managed in a coordinated way. And the powerful thing that mutuals have done in many areas is that rather than having 17 different organisations trying to work together, often ineffectively, is that they've often been able to bring a wrapper around that, and within the one organisation provide the home care, provide the primary health care, provide the secondary health care, and manage the relationship with the hospital and the council. So what mutuals do very effectively is just that. I want to talk very briefly about the example of Central Surrey Health. Now, Central Surrey Health is, or CSH as they know, is an exciting organisation. It was one of the first spin-outs, and they've really gone large on the idea of integrated care. And their latest initiative, which has grown out of their healthcare service, is something called CSH Home Care, Central Surrey Health Home Care. So every contact they have now with somebody who's got a health condition, maybe they need physio or occupational therapy or something, they've got an opportunity to sell a package of home care so that somebody in their area can get not just their medical support but also their social support from CSH. And what they're doing is they're building a very integrated, very holistic package around people. And that's very, very exciting. And again, that wouldn't have happened was that organisation still to be just stuck in the NHS somewhere, unable to invest in a new service, unable to bring together all of those elements in the way that they have. They've used their commercial freedom to do that. As part of all this, as part of their development, they've made a very interesting partnership. And again, this is another freedom which mutuals have. And that partnership is with Bupa. Now, you've probably heard of Bupa. It's a large healthcare company, which is sometimes called private, but actually it's a mutual. It's a not-for-profit organisation, and they partner with Bupa to create several new services. Bupa have put up the money and co-invested in it, and are helping CSH, the mutual, to reshape its offer. And again, this is involving big investment, a lot of expertise in new areas, and a partnership with another organisation. And again, this isn't something that could have just happened had the services that were formerly in the public sector stayed in the public sector. So there's something about that commercial freedom which gives mutuals the ability to move quickly to create these kind of integrated services. Finally, why do integrated services really matter? Well, it's very, very clear why they matter. The NHS, as you probably know, is facing an income gap of £30 billion between today and 2020. That's a significant gap, that's which to be bridged. On the other side, councils, which provide social care, are also under huge pressure, partly because the NHS is being protected by the government as much as possible. In the middle of this is a huge band of people getting older. So every year, more and more people become the group of people who are over 85 or over 100 increases massively, and this is creating a huge pressure in the system. And what is going to happen without integrating care and support is that more and more of those people are going to tip into hospital and end up putting intolerable pressure on the NHS. So politicians of all sides, Labour, Conservative and Lib Dem, are all pushing hard the idea of an integrated care, because if you can get it right in people's homes, and hospital at home and care at home, you can stop them going into hospital. Because when they get into hospital, that's when it gets really expensive, and that's when the outcome actually isn't always very good. So integrating care and support through bringing budgets together and then finding providers that can actually offer this is going to be very important. And you know, of the 100 or so mutuals, many of them are already involved in putting together an integrated offer that is way ahead of what the council or the NHS or indeed the private sector can often provide. So if you're in a mutual or thinking about becoming a mutual that's putting together an integrated health and social care offer, this is a good time to do it. This is a really good time to do it, There is lots of support there, the mutual support programmes there, which you can access through the Cabinet Office. There is a whole load of social investments out there for organisations that exist, that want to do this, that will provide the resourcing to do that. Bupa is just one example, but there are many more. And there are opportunities through things like the Better Care Fund locally, which are commissioning new projects to enable the better, to enable providers of integrated services to deliver their offer. So I think it's a fantastic time to be doing this. I think it's a great time to be creating new ventures in this space, and I think it's a very, very good environment in which to try and market and sell this kind of an offer. It won't be easy, it never is, that's why people like us are here to help you make it happen. But the finance is there, the commissioning environment is moving in the right direction, and there are many, many inspiring examples of mutuals, some of which I've talked about today, that you could go to find more information. I think that's enough for now. Thank you for watching this film. If you want to get in touch with myself, you can do so through our website, which is stepping-out.biz. My name's Dearden-Phillips again. I'm the Managing Director of Stepping Out, and thank you very, very much for lasting to the end of this film. Thank you. Goodbye.